I'm Stephanie Wade. I'm a registered nurse and I'm here with today's health tip, recognizing stroke symptoms. Let's talk about some of the stroke symptoms that you want to be able to recognize out in your community for friends and family. We use the acronym FAST, being face, arms, speech, and time. Many symptoms can appear that are transient, which means they come and go, or they can be long-term. So we want to talk about the FAST. When you have a family member, if you see any type of facial droop or changes in their facial appearance, then you want to consider a possible stroke symptom. When we talk about the A for arms, we look for what's called drift. So if you have a family member hold out their arms in front of you like this, and one of their arms may drift down, that's what we call drift, and that's what we're looking for in their arms. When we look at speech, there are many different ways you can have impaired speech. It may be that you can't speak at all. It may be that you're saying the wrong words in place of what you're trying to say, or it may be a slurred speech. Additionally, if this patient has had a stroke previously, you want to know if this is their baseline or not. So it's very helpful for that family member to accompany them to the hospital so that we know if this is a current new symptom or something they've had long term. The last thing we talk about is time, for T. Time is very important when you consider stroke. If you get to the hospital within the first 3 hours of your stroke symptoms starting, there is a medication called TPA, which is a tissue plasminogen activator that can be given. It's a clot buster that can help decrease your symptoms, sometimes even resolve altogether. So it's very important to know when did your symptoms start and keep that time in the back of your head. If any of family member develops weakness, especially if it's on one side of the body, being arms, legs, face, then that would also be a symptom. You can also have nausea, vomiting. You can have pressure or pain in the head, especially if this is the worst headache of your life, then this would be something you would need to be evaluated for. You'd want to call 911. Do not try to drive yourself to the hospital, and that way we can evaluate you based on those symptoms.